Thyroid gland is endocrine gland. It has following part. This is isthmus. This is two lobe of the thyroid gland. This is upper pole. This is lower pole. Isthmus is related with in front of the second to third tracheal ring. The upper pole is situated middle of the thyroid cartilage and lower pole extend up to fourth or fifth tracheal ring. This is the cross section of the neck. This is anterior jugular vein, then deep fascia of the neck, investing layer of deep fascia, and there are some muscle, sternocleidomastoid, sternohyoid, sternothyroid, omohyoid, and then pretracheal fascia covered the thyroid gland. This is thyroid gland, this is lobe, this is isthmus in front of the trachea, and behind the trachea this is esophagus. This is the CT scan of the thyroid gland. This is the trachea, this is isthmus, and this is thyroid gland, lobe of the thyroid. This is common carotid artery. This is internal jugular vein. This is false capsule of the thyroid gland, pretracheal fascia. This is true capsule of the thyroid gland, and this is intercapsular space. And deep to the true capsule, this is the location of the venous plexus of the thyroid gland. This is the posterior surface of the lobe of the thyroid gland. You see, this is the inferior thyroid artery. Just above the inferior thyroid artery, this is the location of the superior parathyroid gland, and near the inferior pole, just below the inferior thyroid artery, this is the location of the inferior parathyroid gland, and sometimes the parathyroid gland may present within the thyroid tissue. The relationship of the recurrent laryngeal nerve to the thyroid gland and the inferior thyroid artery. Sometimes the recurrent laryngeal nerve situated deep to the inferior thyroid artery. Sometimes it's superficial to the inferior thyroid artery, and sometimes pass through its branches. So some recurrent laryngeal are deeper structure, some superficial structure, and some pass through the branches of inferior thyroid artery. In thyroidectomy operation, a transverse incision is given 2 cm above the suprasternal notch. This lies in the line of natural skin fold of the neck, and skin flaps are deflected together with platysma muscle. Then the investing layer of the deep fascia is cut longitudinally. Between the step muscle and between the anterior jugular vein. If more room is required in case of large goiter, the step muscles are divided. These muscles are divided, and this is carried out at the upper extremity because their nerve supply enter the lower part of the muscles. In thyroidectomy operation, both recurrent and superficial laryngeal nerves are at risk during this procedure, so which need more carefully injury of these two nerves is carefully avoided. During thyroidectomy operation, the superior thyroid artery is ligated near the gland to save the external laryngeal nerve, and the inferior thyroid artery is ligated away from the gland to save the recurrent laryngeal nerve. And the venous plexus lies deep to the true capsule. So, in surgery, thyroid gland is removed along with the true capsule to avoid injury to venous plexus. So, the anatomy of the thyroid gland and its relation is very important in thyroidectomy operation. If you like this video, please press the like button. Please subscribe my channel. Thank you for watching.